Hey guys, it's Dr. Keen, and we're going to talk about rhythms today in the EKG interpretation. Last week we talked about how to break down the EKG itself into different parts and how to analyze these different parts. Today we're going to look at them as a whole and look at what different types of rhythms look like. Now, this chapter 9 PowerPoint is actually really long, so we're going to break it up into different parts. We're going to do one part this week, next week we'll do another part, and then we'll do the last part towards the end. The third week. So we may break it up into two parts, but we're going to go through and split it up because this chapter 9 one is really long. As far as the caduceus material, there's caduceus 104-2 that goes along with this too. We're not going to go through that slideshow because it's really long, but you should use it as a reference to go look at what the different rhythm interpretations are and what they look like. So let's take a look at the different parts and the different types of rhythms here. Now, these are just definitions, so I'm not going to go through and read each definition. You can see these and look at them. We're not doing note cards at this point, but it'd be a good idea for you to make note cards for yourself anyway, just so you can remember what these terms mean. We're going to use these terms here as we look at the next parts here: sinus rhythm, atrial rhythm, junctional rhythm. These are all terms that we're going to use as we look at this. Sinus rhythm means that it starts at the SA node, which is what it's supposed to do, right? Atrial rhythm is where it originates somewhere else in the atria instead of the SA node. And then the junctional rhythm is when that cardiac rhythm originates in the cells near the bundle of His, so that's even past the atria. So that's how you see those differences. Ventricular rhythm, it's starting in the ventricle, which is abnormal. And then heart block is where AV node and the bundle is actually delayed because there's a block of that electrical impulse through the heart. And then underlying rhythm is the basic rhythm of a patient's heart, separate from the abnormal beats or complexes. So this is the complex we've been talking about, and you should know this by now, how this whole sequence goes. But there's different ways in which abnormal beats or rhythms can occur. If the SA node fails, it doesn't mean that heartbeat's not going to happen. Sometimes the SA node fails, and then that beat is just generated at a different place, like in the atrium or in the bundle of His or in the ventricle itself, or and so that's known as what's called an ectopic focus or ectopic pacemaker. Ectopic means outside of its normal area. So when a beat is originated somewhere other than the SA node, it's called an ectopic focus or ectopic pacemaker. So when you're looking at dysrhythmias, remember, dysrhythmia is different than arrhythmia. If you remember from your medical terminology, dys means bad, abnormal, different. So dys would mean that it's not that the rhythm is off. It just means that the rhythm is different than normal. So it might be too fast, too slow, originate somewhere else. So there's 5 different areas that a heartbeat can actually generate and originate. Sinus is where it starts at the SA node, where it's supposed to. Atrial, obviously, is where it starts with the atria. Junctional, we talked about with the AV junction, or where the bundle of His is. Ventricular, very simple, it starts with the ventricle. And then heart blocks is caused when problems in the conductional electrical system between the atrium and the ventricle is there, and so a block means that electrical impulse can't quite get through. We're going to see what these look like as we go through these different examples here. So remember the steps on analyzing the rhythm of an EKG. You did this when we did the last section, and you should have gone through some of those exercises and learned how to look at the different rhythms and understand them and break them down. So you determine the rate, and that's using those different methods The 300 method or 1500 method. Remember, the 6-second method is really only for arrhythmias. You examine the rhythm, go from R to R, and you make sure that that rhythm is even. Note the P wave, look at what that looks like, and we'll see how that determines what kind of rhythm it is by looking at the P wave. PR interval, remember, should be somewhere between 0.12 and 0.2 seconds, and the QRS interval should be less than 0.12 seconds, and then you name the rhythm. So you did a lot of that before, we just haven't really named rhythms yet, and we're going to start doing that more this week. So some tracings will show normal rhythm, some will show dysrhythmias, some will show arrhythmias. So we're going to see what the different types of rhythms look like and how they come out. So it takes a lot of practice though. So don't get discouraged if you start looking at these and you're like, I don't know what I'm looking at. I don't understand this at all. Yeah, you're not going to at the very beginning, okay? I'm just going to give you a heads up. You're not going to understand it right away. You're going to start, when you start looking at these, there's going to be a period of time where you're just going to be like, I don't get these. But the more you look at them, the more comfortable you'll get, and the more you'll start to kind of understand, and it'll pop out at you a little more what it's supposed to look like and what you're seeing. So sinus, tachycardia, bradycardia, arrhythmia, and arrest. Remember, sinus means that it starts at the SA node like it's supposed to. Tachycardia is fast, bradycardia is slow. Arrhythmia means it's not equal. Those, you're getting a couple beats in a row that are normal, and then you get a little pause. Arrest means that it actually stops for a period of time and then pops back up again. We're going to look at what these look like. So normal sinus arrhythmia, or sinus rhythm, sorry, not arrhythmia, but normal sinus rhythm. You got this nice, steady, even rhythm, okay? And you can determine the heart rate there. Remember, normal heart rate is between 60 and 100 beats per minute. So if it's over 100, like this one's 107, it's nice, even, and steady, but there's too many of them. So that's sinus tachycardia. There's not enough here, so that's bradycardia. Sinus arrhythmia, so you got more space here than you do between these two. Over here, even more. Okay, so they should be nice and even. If they're not, that's an arrhythmia. And remember, if you have this PQRS T wave, then that's a sinus rhythm. That's looking good, because you're getting, remember, the P wave is that atrial depolarization. This is a sinus arrest, so you can see how there's nothing here for a while, and then it pops back up again. So those are things to determine the rhythm that you're looking at. Symptomatic and asymptomatic. Now, you should know that this means by now, but symptoms are something that you feel, something that you're experiencing, something that is occurring because of whatever's going on with your heart. So if you're getting some kind of symptom, then that would be symptomatic. Asymptomatic would be you're not. You have the problem, but you're not getting any symptoms. So the reason why we're showing you those definitions is so because we're going to look at kind of what occurs because of these rhythms. So normal sinus rhythm, everything's good, no symptoms, heart rate is normal, everything's perfect. But just remember that children or babies have much higher heart rate than adults do. So if theirs is really fast, that's considered normal. Sinus tachycardia is fast, so there's a lot of different things that can cause that. It can be a heart condition, but it could just mean that they were very active right before they came in, or it's hot out, or they're not feeling very well, their blood pressure is high, those kind of things. But the main thing you want to understand is history with those patients, and whether it's something to be concerned about if they have heart problems in their history. Bradycardia is a little different. That blood's not flowing quite enough, so you could get dizziness, lightheadedness, shortness of breath. low blood pressure, that kind of thing, because the heart's not pumping as much, and so there's not as much blood going through the body. But again, you got to consider history, because if your patient is an endurance athlete, then they're going to have a slower heart rate, and they're still going to get enough blood to their body because their heart is stronger and it's going to pump more blood each time it beats. So just consider that history. Sinus arrhythmia. This rarely requires treatment. Don't see arrhythmia and think, oh man, that person's got a problem. Rarely requires treatment. Sometimes people live with an arrhythmia their whole life. Occasionally, medications are necessary, but not always. So, sinus arrest. This can be caused from SA node damage, and medications can cause it. And increased vagal tone. Vagal tone is talking about the vagus nerve, which is one of your cranial nerves, which goes around and controls all kinds of functions throughout your whole body and your organs and systems and stuff. So if the vagus nerve is an issue, then the heart may slow, and that's something that would have to be addressed. But patients who are asymptomatic, they may not need treatment, but there is medication that can be used. So sinus rhythm practice, I'm going to let you guys go ahead and look at these and see if you can break it down. And remember, you have this PowerPoint in your Canvas as well, so make sure you take a look at it and use that as practice. See if you guys can break these down and do well with them. I'm also going to give you an assignment with some practice as well, so you can work through that. Identify atrial rhythms. So we're going to look at atrial rhythms here, and this will be the last part that we're going to talk about for this section. Premature atrial complex, wandering atrial pacemaker, atrial tachycardia, and multifocal atrial tachycardia. So premature atrial complex means that the beat is happening too early. We'll look at what this looks like here in the on the chart here in a second. Wandering atrial pacemaker, atrial rhythm occurs when impulses arise from multiple areas, and we talked about that before. Sometimes it'll arise from the SA node like it's supposed to, or sometimes from the AV node, or sometimes from the ventricle itself. Atrial tachycardia, really fast atrial rhythm, and then multifocal rhythm related to wandering atrial pacemaker, which is over here, but ventricular rate is greater than 100 beats per minute. So then you have a supraventricular tachycardia, atrial fibrillation, rapid ventricular response, and then atrial flutter. Supraventricular tachycardia is that impulse is generated above the ventricles, so right where that atria and ventricle come together, so kind of basically close to the AV node or the bundle of His. So P waves are difficult or impossible to distinguish. QRS is really narrow. Atrial fibrillation, this one's really fast. So you're going to see kind of like almost like a flutter in the reading. Rapid ventricular response, the rhythm's fast, over 100 beats per minute, and then atrial flutter. This fires really fast, rapid rate. So F waves, flutter waves, atrial rate, and then ventricular rate. So make sure you look through these definitions. The F waves are kind of distinct because they have this sawtooth or picket fence wave to them. So here's what we're looking at. This is what they look like. Premature atrial ventricular complex. That P wave is really flat. Wandering atrial pacemaker. You got rhythms irregular, and P wave looks different all the time. Atrial tachycardia, P wave interval is not measurable. So this is what all of these look like, the definitions that we looked at. So make sure you look through these and understand them. Here's that atrial flutter and that sawtooth appearance. So make sure you look through these and understand them, and we'll go through the rest next time.